I think we're going to hit.
Okay, so I was asked to talk about NJ FamilyCare. So just some basics, just so everybody's on the same page. New Jersey FamilyCare is New Jersey's publicly funded health insurance program, meaning that unlike what you might have in terms of medical insurance through a job, you get New Jersey FamilyCare through the state. Okay, the website is njfamilycare.org. The program is supported by federal Medicaid dollars and what we call CHIP, or Children's Health Insurance Program dollars, and then state funding. So typically with Medicaid, what it means is for every dollar that New Jersey spends towards the health insurance, the federal government also picks up a dollar. It's a 50-50 split. The Children's Health Insurance Program was actually started back when Bill Clinton was president. And the goal of that was to provide health insurance for people whose incomes were a little bit higher, but they did not have health insurance for their kids through their employer. And so again, there's a contribution by the state and the federal government, but it could be a different percentage. But in New Jersey, all of that funding is put into the New Jersey FamilyCare program. And this program has been around for many, many years. In terms of the income level, we have one of the most expansive programs in the country. I think New York is the only state that covers more kids than New Jersey, meaning that for a household of 4 people, where you have 2 parents, 2 kids, or 1 parent, 3 kids, if your income is $8,210 a month or less, and you don't have health insurance for your children, you can enroll your kids in New Jersey FamilyCare. It's pretty expansive. A lot of other states cut their coverage maybe at 250% of federal poverty. New Jersey also covers low-income adults. It used to just be parents, but now single adults can also get coverage through New Jersey FamilyCare. So that could be a young person. FamilyCare goes up to age 19. So let's say my child, turns 20 and they still aren't working full time, or they're working, but they don't have health insurance coverage. Depending on their income, they might be able to get coverage through FamilyCare. And so for a single person who makes less than $2,106 a month, they can be in FamilyCare. No, I'm sorry. That would be for a couple, or for a single person, it would be $1,560 a month. Okay. They used to have premiums where you have to make what we would call almost a monthly payment. It could be $20 or $40 a month as part of your cost of the coverage for your children. And they eliminated those premiums as of July 1, 2021. So as long as a family is eligible based on their income, their children can be enrolled in FamilyCare. FamilyCare covers medical, prescription, vision, dental care, which a lot of people don't realize, mental health care, and some substance abuse services and hospitalization. So again, it's a pretty expansive program. Now, in New Jersey, there's been a great effort to try to make sure that all kids who are eligible are actually covered. Our uninsured rate is less than 4% of the children in the state who might be eligible for FamilyCare are not enrolled in the program. And that's pretty good. One of the groups or categories of children who were not eligible for FamilyCare in the past were children who were here but did not have the appropriate immigration status, meaning they were undocumented. So as of January 1st of this year, all children who are eligible based on their household income and under the age of 19 can be enrolled in New Jersey FamilyCare regardless of their immigration status. So the state just put together a website, and I'm going to, if I can, reduce this a minute, because I was just at a meeting this morning where they were giving some information regarding the progress of this. Let me see if I. Let's see. I want to share another screen. Okay, so hopefully people can see this. So this is information that was provided this morning regarding the Cover All Kids update. And this was at the Medicaid Advisory Committee meeting. So Cover All Kids was to make sure that 3.9% of children who do not have private health insurance, but are not enrolled in New Jersey FamilyCare, but eligible, actually get enrolled in New Jersey FamilyCare. So what this slide shows is that since July of 2021, when the Cover All Kids legislation was enacted, the state has enrolled over 51,000 more children into New Jersey FamilyCare. So as of this month, there are 912,248 children under the age of 12 who are covered by New Jersey FamilyCare. That's a significant amount. There's actually 2.2 million people. So that is children, low-income parents, or low-income single adults currently in New Jersey FamilyCare. And that is a 30% increase from before the pandemic. Many people believe that it's because the public health emergency established some criteria that required states to maintain coverage for anybody who was in the public health insurance program, even if they were no longer eligible because their income had changed. Meaning, if you were getting federal funds like federal Medicaid dollars or federal CHIP dollars, and families have been determined to be eligible for New Jersey FamilyCare, they could continue to maintain that coverage and did not need to have their eligibility redetermined. Typically, under a public health insurance program like New Jersey FamilyCare, the family has to provide income information on an annual basis for the state to determine that they are still eligible. So during the whole COVID shutdown and up until recently, based on the public health emergency, anybody who was enrolled could maintain their coverage. This slide just really talks about covering children who were previously not eligible because of their immigration status. If you know of any families of children who are what we used to call undocumented, but they don't have legal documents to be here in this country, they can still be enrolled in New Jersey FamilyCare. And the website is nj.gov/coverallkids. And I'm just going to take you to this slide now. So there's information they can apply. There's an application process. But what I want to show you is there's a lot of different languages. The materials are in a lot of different languages. So if you click on one of these.
Mary, I think we're still seeing the PowerPoint.
Oh, sorry.
That's
Thank
okay.
you. I have to stop share and then share again. Okay, so this is the new Cover All Kids state website. So you can send somebody to this site. It's nj.gov/coverallkids, and they can get materials translated in numerous languages, and people can use this website to apply. There's also resources, fact sheets, any information, any of you who might work with an organization that interacts with families. If you want to share materials through some type of faith-based community, or your children are involved in some type of social club or Girl Scouts, Boy Scouts, Boys and girls clubs, it's really important to try to get the word out. And that's why we're asking people to share this information. The application is fairly easy. People do need to supply income information, but I can actually make the translation work. Maybe not, but I do know you can get the information translated through this website. Okay, let me just go back. All right. So the other piece of this that I wanted to talk about today, which again, we need everyone's assistance, is that because the public health emergency is ending and because Congress has separated the funding from the budget, which had provided states with the money to just have continued coverage through the public health emergency, New Jersey FamilyCare and Medicaid have to redetermine eligibility for those 2.2 million people that I mentioned are currently enrolled, or those 912,000 children who are currently enrolled in FamilyCare. And what they described in the meeting I was just in is that they're going to do that starting April 1st. What's really important is that anybody who has been enrolled in New Jersey FamilyCare, that they make sure that New Jersey FamilyCare has their current contact information, because the redetermination mailing and the paperwork will be mailed to the family. It cannot be emailed. It can't be sent via text. It has to be mailed. And so a lot of people who have been in FamilyCare, because they did not have to have their eligibility redetermined every year, they may have moved, they may be living with other family members, and they may not have updated New Jersey FamilyCare with their current address. So if you or you know anybody who is on New Jersey FamilyCare, it is really important that they call this number, 1-800-701-0710, and provide their current mailing address. Starting April 1st, people are going to be getting a letter from New Jersey FamilyCare with information regarding their income and what is on record with New Jersey FamilyCare. If New Jersey FamilyCare doesn't have income information, they're going to ask the family to provide it. For some families, if they are already enrolled in some other program, such as SNAP or WIC, or they have a W-2 wage job, New Jersey FamilyCare may be able to verify their income administratively, meaning they can go to that program and confirm what the current income is. But if they can't do that, then the family has to provide current income information. So it's really important that any letters that families get from New Jersey FamilyCare saying we need these certain documents, that the family responds within 90 days of getting a letter. These letters people should not ignore. There could be some people for which New Jersey FamilyCare doesn't have any current income information, and the family needs to provide that income information because they will be terminated from FamilyCare if FamilyCare doesn't have the information, okay? The families will have 90 days which to respond. I'm just going to stop sharing now. And if the family doesn't respond, their FamilyCare coverage will be terminated. If they do respond, even if it's a little bit late, their coverage can be reestablished retroactively, the 90 days. Okay. What we heard is that if a family, so let's say I've been on FamilyCare and every year, even though I didn't have to, I got my paperwork to redetermine my eligibility and I completed my paperwork. And if that was March of every year, then I'm not going to get this letter from Medicaid until March. Or if I was doing that redetermination in November of every year, I will get that redetermination paperwork in November. For people who basically just ignored information coming from New Jersey FamilyCare, I can't really tell you when they might get it. And so it's just really important that if people get any correspondence, any letters from New Jersey FamilyCare, that they don't ignore them, that they respond. There is an appeal process. It is New Jersey FamilyCare's goal to maintain coverage for as many people as possible. They do not want to see coverage dropped, but because there's 2.2 million people that they have to redetermine eligibility, it's going to be a little bit, I'm going to say, hectic. So they're going to try to do special populations, people who might have certain disabilities. There's going to be some additional outreach for those people. The managed care organizations have been trying to provide updated addresses to New Jersey FamilyCare for those people for which they have an updated address. So if I've been in touch, with Horizon Blue Cross, and I've been in touch with my care manager, and they have my current address, and I've moved over the past 2 years. Horizon has sent that information on to New Jersey FamilyCare. What we're saying is people shouldn't assume. People should call that number and make sure their information is current. All right, because we don't want anyone's coverage to be terminated. The other thing, the other thing they did tell us is that in terms of the Cover All Kids campaign, there are going to be some outreach grants. So if you work for an organization or if you are affiliated with a nonprofit, because I'm assuming it's going to be nonprofits, there's an application being put together and being reviewed, but it should be on the Department of Human Services website, probably in early spring. So I would say the next month or two. And there are going to be some outreach dollars that people can apply for. I think what they're looking for is organizations that have some connection to special populations, certain cultural groups that typically have a lot of immigrant families or families who are here who are not documented, that they're trying to reach those families. And I would encourage you to watch the website. If we find the application, I'm sure Migdalena or Hannah will send it out to the group. But if you're interested, then you can apply. But I do think it has to be, it's probably going to be a nonprofit that has to apply. I don't know that it could be an individual, but you might be affiliated with a some type of faith-based community or a community organization, and you could tell them about that opportunity. So that's my kind of spiel. I'm happy to answer any questions. I know sometimes people find the application process complicated. Believe it or not, they've streamlined it over the years. It used to be much worse. And people can get help. I mean, there are people who can help fill out an application. So I don't know, do people have questions?
Mary, we're going to stop the recording now, okay? So
Okay.